Assalamu alaikum. My name is Aamna Sajid and I'm presenting on behalf of Dr. Macksood Aftab. I was lucky enough to assist him while writing this paper, and I'm really happy to be here today and presenting on behalf of him. So I will be talking about neuroimaging and the soul, so implications of clinical use of advanced neuroimaging on the discourse concerning the soul. So the recent advancements in advanced neuroimaging has opened up new avenues to study consciousness and interrogate the mind-body problem. In the clinical setting, it provides for the assessment of consciousness, which were previously not available. This technology, however, raises its own sets of ethical issues which relate directly to the use of technology and its scientific basis. The clinical use of this advanced functioning imaging carries significant philosophical implications, the most important of which is the use of intentional thought as a measure of consciousness affecting therapeutic decisions. Functional MRI is a method of imaging which combines both structural and functional imaging of the brain. It allows for the localization brain activity to specific regions of the brain. It has allowed for the correlation of cognitive activity with specific areas to the brain parenchyma. Functional MRI makes use of the detection of increased cerebral blood flow and oxygen uptake in areas of the brain which are metabolically active. The implications being that areas which are accumulating and metabolizing oxygen are the areas which are being activated for specific sensory, motor, or cognitive tasks. Functional MRI is thus a measure of the fuel uptake within active brain areas. It is not a direct measure of neuronal activity output. Nevertheless, this technology provides for the ability to assess for brain functions in a way which was not possible before. A patient's motor response, such as eye or lip motion, is no longer required to assess for consciousness. Instead, it can potentially be directly assessed by assessing for areas of activation in the brain. Clinically, the assessment of consciousness relies on the evaluation for arousal and awareness. Both must be present. The disorders of consciousness include coma, vegetative state, minimally conscious states, and locked-in syndrome. In coma, neither arousal nor awareness are present. In a vegetative state, patients may be arousable but lacks awareness. In a minimally conscious state, patients demonstrate inconsistent and intermittent evidence of awareness. In locked-in syndrome, patients are fully conscious but are unable to communicate with outside world due to disruptions of brain communication pathways in the brainstem. Some locked-in syndrome patients are able to communicate with limited eye movement only. In these patients, the fMRI has the most to promise. Awareness is, however, a subjective concept, which is most immediately assessed on a first-person basis. Only the individual is fully aware of their thoughts, mental status, and cognitive ability. However, in the clinical setting, when the patient is not fully functional and not able to fully communicate, the first-person account is not available. In this setting, an objective measure of consciousness is required in order to make clinical decisions regarding the patient's care and for prognostic purposes. This assessment requires some sort of response on the part of the patient based upon outside input. The idea is to assess for intentional ability on part of the patient. Is the patient able to understand and make decisions? If they can engage in willed actions or demonstrate intentionally, then awareness and consciousness would be established. This had traditionally been assessed on clinical grounds by neurological exams. More recently, advanced neuroimaging has been used to assess for consciousness, which does not require a motor or a physical response on the part of the patient. Prior to proceeding to the use of functional MRI in consciousness, it is worth reflecting on the principles being applied in the determination of consciousness. Clinically, consciousness has been defined as the ability to engage in willed action. Those who are not in coma but lack consciousness are considered to be in a vegetative state, and thus carry a very poor prognosis. This has implications for treatment, rehabilitation therapy, which is considerably reduced for those unable to demonstrate intentionally. Thus, in a practice intentionality is used to measure of a person who is worth saving. This implies to some degree that what it is to be fully human is to be able to engage in willed action, the absence of which downgrades the resources placed into saving a life. Willed action is then implicitly being used as the gold standard for the highest state of consciousness and of personhood, implying that what it is to be fully human is to engage in decisions and free will. This echoes the thought of the 20th century Muslim philosopher Muhammad Iqbal, who articulated a theory of the self which relies on the exercise of free will as the defining property of humanity. He argued that the mind and the body come together in the exercise of free action, and therefore it is misleading to create an artificial dichotomy between the physical and metaphysical elements of man, as can be described by dualism. Neither define the human, rather what defines him or her is the ability to engage in free action, and it is via such action that a man or a woman is able to reach the full pinnacle of their human potential. In the absence of functional neuroimaging, an assessment of a patient's ability to engage in willful thought or action require a clinical neurological exam which required the patient to demonstrate via physical action, such as a finger movement or an eye movement, that they understand, communicate, and can make choices. Patients who lack appropriate control of their limbs and bodily function due to brain injury or stroke may not be able to communicate their thoughts in this way, thus making it difficult to differentiate patients in a vegetative state from a minimally conscious state and locked-in syndrome. With functional MRI, brain states can be assessed directly by examining brain activation and opens up new possibilities in the study of consciousness. Consciousness can be assessed by 3 levels with functional imaging, the first being passive, the second active, and the third communicating. At the passive level, brain response is assessed after a sensory input, so an image shown to the patient should elicit a response in the visual cortex. This provides a baseline for the functioning of the neural hardware. However, it is unable to disentangle automatic responses from voluntary conscious brain activation. In the active experiments, patients were asked to engage in a particular thought to assess or command following via imagery tasks. They may be asked to imagine playing tennis or imagine walking through their home. Their ability to selectively activate different brain areas provides evidence for the voluntary modulation of brain functions. Modulation of brain function is a strong indicator of a patient's ability to express a desire or willed action and free thought. The highest level of consciousness is communication, which is assessed via asking the patient to answer questions. In response to a question, the patient is asked to engage in imagery tasks. The questions have typically been ones to which the answers are known. So questions can be like place of birth or the number of siblings to assess for the accuracy of this method. The patient's ability to communicate then is considered clear evidence of consciousness and the ability to engage in willed action. Despite these advances, there are some limitations to the functional MRI studies. Some patients have been upgraded from a vegetative state to a minimally conscious state by the use of fMRI, immensely affecting their prognosis and treatment plan. However, relying solely on fMRI, the majority of minimally conscious patients, as determined by clinical exams, could not be detected. Therefore, clinical exams remain the most sensitive study to assess for minimally conscious patients, since even though it relies on neurological exams. Furthermore, it has been noted that many healthy volunteers are able to perform physical tasks without being able to successfully perform the corresponding imagery tasks on minimally conscious patients. This furthermore lowers the sensitivity of fMRI in detecting consciousness. Much of these limitations may relate to the limited data currently available, and as the techniques for assessments improve, the sensitivity of fMRI would likely improve as well. Does fMRI help answer the hard question of consciousness? For example, how does neuronal activity generate metaphysical thought or emotion? No. It simply provides a correlation between the areas of brain activation and corresponding thought. Even so, its clinical use has important clinical and philosophical implications, the most important of which is the reliance on free-willed action as the gold standard test for consciousness. By extension, this implies that what it is to be fully human is to have the capacity to engage in intentional thought. This is an important advance where a human is not being defined by presence of a metaphysical entity such as a non-material soul or the physical entity such as the presence of certain body parts. Instead, free will becomes the hallmark for humanity. Thank you.